Most underbites are the result of an underdevelopment of the upper jaw. In the case of a deficient upper jaw, a procedure called a Leffert 1 osteotomy is performed to correct the deficiency. To assure the correct alignment of the teeth after upper jaw surgery, the patient first undergoes orthodontic treatment to correct any misalignments. Then, just prior to surgery, surgical arch wires are fabricated and placed to prepare for stabilization of the newly advanced upper jaw. The Leffert 1 technique involves moving the maxillary jaw forward to correct the underbite and rigid fixation of the newly positioned upper jaw. The rigid internal fixation utilizes compression screws or plates, which allows the surgeon to avoid having to wire the jaws shut after surgery. Interarch elastics are used to help limit the overuse of the jaws right after the surgery, allowing for stabilized healing of the jaw. After the surgical phase, the patient continues with their orthodontic treatment to assure final proper alignment of the teeth. The result is a healthier and more attractive overbite and smile.